provided in this podcast is not intended to be medical advice. It is medical awareness shared by patients showing how they are using medical cannabis to help them treat their pain and improve their life. We do this in hopes that it will give you information that will assist you in determining how you should move forward in treating your chronic pain. Hello, and thank you for joining us. We're so glad you're here. We're excited to be bringing you the second segment in our series of Living in Chronic Pain with Cannabis. Today, Leah and Red for Men are returning to help us continue this segment so that you can get a full picture of what their life is like living in chronic pain and using cannabis, and understanding the choices that they make and why they've made those choices. So come along, let's relax, enjoy, and let's learn. Everyone can learn a little something today. Hi, we're going to pick off where we left off last time, just discussing how cannabis and pain are working for us. Leah, has there been any real negative impacts to your health, your life, your family, your job since you started using medical cannabis?
My life is great. I think 99% of the cannabis and CBD experience is beneficial once I learned to navigate it. And my family is awesome. My whole life has changed in a positive way. And the only problem I have with it is with my job, and I can lose my job if I test positive for cannabis or any other drug. And I am on prescription drugs, and I have listed that. And I did let them know during my recertifying interview after coming back for 4 years being disabled. And it's a gray area, and it's very difficult because we are random tested on our job, and I have no acknowledgement from my job that I will be able to keep my job. So I'm living on the edge.
And just a reminder, everyone, Leah is a nurse. Didn't see the first podcast. That's what she's talking about, being recertified. Red for Men, how has cannabis been a negative impact on your life with your family, your health, your job?
I would say the only negative impact that cannabis can eventually have on me is that if I get drug tested during school, I can lose everything I have worked so hard towards, my degree. Basically, if they come up to me and drug test me, then none of the hard work I put in will count because they would just expel me from college, and that would be that. So I feel like that can eventually be the only negative impact cannabis can have, but it definitely too for me has changed my life and for the better. It has a lot of benefits, and we're here to share them.
What is the one thing you wish you would have known about before you started using medical cannabis that you would like to share with other patients and people that are just thinking about starting this? Red for Men?
Start this cannabis experience, going to the dispensary can be obviously confusing, but also you can end up spending a lot more money because you don't know yet what can work for you. But don't get discouraged, because here at Effective Cannabis, they will help guide you. And I feel like also for new medical patients, I feel like the most important thing to understand is that not all advice is advice, because everybody's body works differently, and all of our pains are different as well. So sometimes you just have to try it for yourself, but don't just take anyone's advice, because I feel like when people do that, they tend to get discouraged because whatever is being recommended to them is not working for them. But don't get discouraged. You'll find something that will help you.
That's one of the most important things I think that we hope that comes through with this podcast, is that it's not just go stick out your hand, somebody puts something in your hand and that it works for you. It really is investing in yourself and learning as much as you can about cannabis. It takes a lot of knowledge to do that. And I have some medical background, which helped me, and it was still hard. So that's why we have Effective Cannabis here. Leah, what is the one thing you wish you would have known at the beginning of this process?
Well, and I come from a background of medical, and I do a lot of reading about drugs and just in general, anything I'm interested in, I do have materials to study. But even with that, the first time I walked in, I was undergoing a very serious surgery and going to rehab, and you are very limited in your methods of use, your dosing and all that. And I had no basis. I had no dosing from my doctor. And of course I walked out with RSO, which was very strong. And it was 1,000 milligrams in a 10 ml syringe. And they told me to start at 1 ml. And since I've met you and talked to you many times, that less is more. So needless to say, I stayed in bed because I did not want to fall. And then the next time from there on out, I started very, very small. And it was very effective post-op, but it was very scary. And I recommend people to come to Effective Cannabis and get some information, talk to the pharmacist, and start low, work up. I did with my CBD suppositories and my cannabis. I did keep track daily, twice a day, of my vital signs, the drugs I took, the drugs I didn't take, what my response was. I did that for 3 months. And now that helped me a lot, but I'm from a clinical background. So the everyday person might not do that. So it's very nice. This is 2 years post my first neurological surgery, and I'm 3 surgeries in now since meeting you. And to know that there is a pharmacist that I can contact changed the whole ball game for me, because I was very hesitant for cannabis. So meeting you has really been great for me.
Thank you, Leah. That's very sweet. I think it's really important that we understand that it is hard to do this and that it takes all of us working together to try to understand this, because this truly is medicine. For me, the biggest difference between the beginning and now is that when I first walked in, I first had no clue what I was going to do. It was like walking into a candy store as a little kid. And they have all these flavors and all these different items that you can pick to choose. And they pretty much convince you to try Gumby and try a tincture and try a flower and try a vape. And I mean, they convince you. It was more about choosing a product than it necessarily was about finding the product that would help you with your medical condition. But then of course that person doesn't know anything about my medical conditions. All I had to tell him is I was wanting to control my pain. He doesn't know what kind of pain I have or what other medications I'm using. And so adding a pharmacist to our support team at Effective Cannabis has been very helpful, because he guides us with our medications and lets us know what we need to be looking for. But journaling is also one of the most important parts of this, whether you have a medical background or not. I still journal to this day, and that's one of the features that we offer on Effective Cannabis, is that you can just pull up your journal immediately. It's almost like an app. You just log in, your journal, the minute you log into Effective Cannabis, your journal is there. And you have access to everything that you've put in. Your journal is as good as whatever you add. And it's important that you give as much information as possible. But the chances of going back to the dispensary and finding the same thing that you bought the last time you picked up cannabis or a gummy, it might not even be available. So it's important to understand what works and what doesn't work, because I'm sure all of you ladies have had the same experience where you have tried a lot of different things that did absolutely nothing but just cost you money.
Yes.
And now we can, the more you're in this, the more you understand what strains you need or what products you need, but even still, they're not always available.
Consistency is my biggest issue with cannabis right now.
Oh, definitely. And that's only going to change if we educate the dispensaries and the grows about what we need. And that's the one thing we find is they're not really interested in what we need. They just produce
enough product for this, whatever they grow this period. And when that grow's gone, it's gone, and then they produce something else. And I understand it has a lot of science behind it and what can grow at a certain time of period. But they also need to understand there's specific things we need, or we're learning this through effective cannabis as we're studying each different specific medical condition, that medical conditions not all medical conditions respond to the same strains. And there's a lot of details about why that is, but that's why it's important that we study this so we understand it, so that we can make sure the right strains are available for the patient when they walk into the dispensary.
And that's why I am attending the Hemp Industry Trade Association monthly meetings, and why I'm talking to growers and I'm talking to manufacturers, because I have an opportunity to advocate for a lot of people through what I do. And I want to make sure that they know the strains that we need. And I did take your list to one of our state growers here, and they were very receptive to what I took to them. So I hope to make a difference. And everybody in their own state, if you're really interested in this, we can't go and buy a 10-month supply of our medication strain that we want because of the expense of it. So yes, once it's gone, it's gone. If your state is going to go recreation, if our state is that it's doing, we may lose the strains that we need. So we need to make our voice heard.
And the good news is with effective cannabis, everybody can be involved. You can be as involved as you want, or just be involved enough for yourself, but we make it possible for you can actually be an advocate in your state. You can, be there going to meetings and meeting. I mean, it's up to you with how much you want to be involved. And it's important because for me, I'm in the middle of quarantine right now because of other health conditions, and I can't even get out and go meet with people. So having Leah go and meet with people and discuss things that are important really does help us at Effective Cannabis. Every one of us that are here and everyone that joins Effective Cannabis, we're all equal. No one's any better or worse. We all have issues that we want to resolve. And all we are here, and what we care about is you, the patient, and that you have success in learning how to use cannabis. What has been the hardest and most difficult thing to maneuver through this process? Leah?
I think it's in my clinical area with my doctors, is that I like to be totally open about all the alternatives. I do a lot of alternative medicine, and I'm not able to share that with the most important doctor I have, and that's not good. The other thing is cost. The cost of renewing your doctor visit and your application in your state costs a lot, and then your product. And so I do want to say that if you really look into it, and through Effective Cannabis, we should be able to join all this data, you will be able to find a provider in your state. I'm able to get 25% off of my cannabis because I'm on Social Security disability. And then I'm also able to get up to 50% off on my CBD suppositories. Not everyone's going to do that, but it's not going to happen if you don't ask.
Right, I was going to say, you have to ask.
Yes.
Well, yeah. So what's been the hardest part for you, Red from Ed?
I feel like one of the hardest parts in general is the stigma that, cannabis has. And for me, sometimes, we're obviously normal people, and we're out there pushing it whenever we have to push it. And sometimes I feel like it should be normal to, take a hit off of whatever you're hitting to medicate because you need it at that point. Just like, when my head hurts, I can take a Tylenol and I'll be okay. And I do that in front of everyone and nobody says anything. But, someone starts to hit it, or with their pipe or something, and everyone's turning around like, oh my gosh, look at that drug addict, oh my gosh, get away from them, or whatever it is. So to me, that is like a really hard thing to go through. But that's why, you know, it's so important to join Effective Cannabis, because through Effective Cannabis, we get to teach people that cannabis is not just, you know, a drug addict drug. This is actually medicine, and it's helping all of us, and it's changing our lives. And I mean, there's a lot of hard things, you know, when you start this process, but to me, that is one of the hardest, because, you know, you have to inform your doctor, or, you know, you start to try to open up with other people, and then they're already having that stigma like, oh, she's a drug addict, I don't want to talk to her, you know. So that's really, really hard. But to me, just, you know, being in need of medicating and not being able to do that is so hard for me, because sometimes I feel like I'm in so much need, because, you know, I'm 25 years old. You know, 25-year-olds like to go to festivals, they like to have fun, they like to travel, they like to do certain things. But, you know, just like for everyone else, sometimes it's just hard to go and do those things, because you have to, you know if cannabis will be available if you travel, or if you go to a festival, can you get away for a few minutes and hit it, because you can't just take it out and just, you know, smoke. So to me, that is just really hard.
And just as a note, not everybody can use the same consumption methods. Red for Med, we know, has found that she can't do edibles because of the way her system processes through her liver. So she processes it out of her liver long before it even gives her any benefit. So learning these things are really crucial, and that's why it's important for her that she be able to either use a vape or a pipe to medicate, because she can't use an edible. So just because all those are available doesn't mean that they work for everyone. And that's all, again, trial and error and understanding your system and how it responds to cannabis.
Deb, since you bring that up, I am not able to smoke, and I am not able to eat or do edibles or tinctures on a regular basis. And my muscular use, or my problems, my spinal problems, my neurospinal problems, and the amount of pain that I am in, I need to keep my levels of CBD and cannabis. I do prefer a higher percentage of CBD. And so I do suppositories. I can do them twice a day if I need to. And then I do topicals because it bypasses my liver, and it takes a little longer, but it works well with the medical condition and the medications that I do take. So there is a whole variety of methods available to people. And that's where the pharmacist, again, comes into play, because they can help you with all of that. You're not going to have to navigate that on your own like some of us have had to do.
Right. That, to me, is the hardest thing that has happened through this process, is feeling like you're all alone, feel like you don't have anyone that supports you or has your back, which is very strange coming from a medical background, because we've always depended on our doctors to be there and support us, and all of a sudden feeling all alone and feeling like you don't have anyone support you. I think that has been the hardest thing for me to navigate and learn. Plus, knowing that every time I walk in a dispensary, I generally hear something different. If it's a different dispensary or if it's a different bud tender, I hear a different response every time, or a different strain, a different product, or I hear I really don't know. And it's nothing against them. I'm not banging against our bud tenders. It's just that this is all medical stuff. And it's not something that we can just give to a group of people and say, here, you can manage this for all of us. It takes all of us working together in the medical community, the cannabis community, and patients, so that we can actually understand how this is changing. And that's exactly why we're all here, to try to help make that happen. If you had to give advice to someone that is just beginning cannabis or is already a cannabis user, what advice would you give them to start or to finish their journey or be on their journey? Red for Med?
I think the thing that I would say is, first of all, it's not in your head, because I've been at my doctor's office, and telling them that something's wrong with me, and they're doing all these tests and they can't find out what's wrong, and it gets difficult, so they just come back and say it's might be all in your head. It's not all in your head. You just because you have an issue and you still haven't resolved it, there's more you can do. Do your research, join Effective Cannabis so that, we can help guide you, look at other people's strengths to see what can suit you. Don't give up. This process can be really hard at the beginning. And most of us do start with trial and error, but that's why I'm saying it's crucial to a new patient to join Effective Cannabis, because it will help guide you, and it won't leave you confused. If you go into a dispensary for the first time, I can tell you from experience that you do become confused. There's so much of everything. There's tinctures, there's flower, there's vape, there's everything under the radar. So you just have to be patient and find your own way, but you will find it. So I just want to say, please don't give up. Cannabis is medicine, and it will help you eventually. We just need to find the strain that will suit your body the most, and we can do that if we do it all together. We're here for you. Join us.
Thank you. Leah, for you, what would be the advice you would give if there's anything different than what Red for Med had to share there?
Well, I would just say two things. There is a job opportunity here for some professional people. The problem is, in the medical profession, it's risky, and doctors and practitioners do not want to take that risk. So us as patients, whether it's an oncologist, a radiologist, a nurse who is doing your infusions, if you're in autoimmune, if you're in autism, if you're in seizures, if you're in spine, orthopedic pain, this can be so effective for you to help your life, but you do have to take a little brave moment and say, especially, I deal with a lot of oncology and a lot of seizures, and be brave. Tell them what you're doing. Find someone in your realm who is receptive and tell them, I would just like to get this in my chart that I am using this strain and this form, and it is helping me so much. I do not have to take the steroids you're offering me. I do not have to take as many antibiotics. I do not have to take as many narcotics. When you get to hospice end of life, there is so much beneficial use of cannabis and CBD, and we need to tell people this is what we prefer, and get it to me. Get it to me, please, because I want to be awake as much as possible with my family. And
Absolutely.
Yeah, from both ends of the spectrum, there are great opportunities if we're professionals to get involved for advocacy. And then someone will step forward and say, I am this kind of practitioner, a pharmacist, a doctor, a physical therapist, and I am open to you. How can I help you?
That's one of the things we're offering to anybody that's in the medical field, doctors, pharmacists, is come along with us, work with us as patients, and learn. We'll learn together. There's no one that knows everything about cannabis right now. If they tell you they do, run. Run as far away as you can get, because this is all new, and we're trying to maneuver through an illegal business because it's still federally illegal.
Yes.
So this makes it very scary for a lot of doctors to get involved. Well, you can be involved at Effective Cannabis behind the scenes. We allow that, and you can learn. You can help patients learn, but they don't have the training in cannabis. They don't teach it in med schools. And so it's really important that we all just start working together to try to prove this. Because if we really look at what medical conditions are improving with cannabis, whether it be autism, seizures, cancer tumor reduction and completely removing tumors, and then we look at chronic pain, we look at MAC lung disease. We've been able to, with my own self, improve my lungs by using cannabis, something we never thought. So if you just think of those medical conditions alone, that is truly a gift to any doctor that has patients that could benefit from cannabis. But they don't know any more than we know. They're learning by trial and error too. I sit and meet with doctors on a regular basis, and they have lots of questions of trying to understand, how does cannabis work? What do I need to prescribe? And it's not a simple answer that you can just say, well, just give them a CBD of 1,000 milligrams, take it twice a day, and that will fix whatever's ailing you. That it's not how this works. So, you know, the advice is that we need to all be getting involved. We need to be caring about this, because this really is going to matter for generations, I do believe. I think there are definitely medical breakthroughs that are going to be happening here. Like I said, we're already making some at Effective Cannabis. And we're small. We're still trying to get the word out to people that we're here. And it's not easy getting this word out because it is an illegal business. Even though we are in medical states, all of us, I get more contacts from people that are not in medical states that want help, and I can't offer them any help. And it's really sad. It breaks my heart. And when I get someone that contacts me and says, I've already planned out how to commit suicide, what am I supposed to do with that other than support them and help them? Because I know that desperation. I've been there myself, and I've had to work myself through that. And having cannabis, being able, I'm not saying it fixes everything. I wish I could say that. I don't know that. We don't know that till we study it. And that's what we as patients can do by joining Effective Cannabis, is putting our data down and reporting what strains are helping us with what. We can look at medical conditions. When I started this, I was treating a number of medical conditions, and now I'm treating even more things that I never thought I would be treating with cannabis. And those are things that we learn over time. And these are things that we need to be documenting so that we can share with people how that works. Being able to eliminate medications, that is really important and huge for sure. And it saves a lot of money. So, I mean, the most important thing is that people understand this is an investment in yourself. And it's important that you take the time to listen, be open-minded, have an open heart, and think about what this might do for you. And because this is your pain, no one else's. And this segment will continue. This conversation is so important. I can't stress how important it is. There are people that are going to be committing suicide today because they don't have access to some form of medication to help them with their chronic pain. This has been going on at least since 2015. This is when I got thrown into all of this, with the opiates not being provided anymore. We haven't made any advancements in moving this forward, and we have to. Every one of you are important. You matter. You at least matter at Effective Cannabis. We hope that you have enjoyed this podcast. We hope that you learned something. We hope that you'll come back and join us. Please click the follow button or the subscribe button if you would like to be part of a podcast and have your voice heard. We would love to have you. This is a serious conversation, and we want to make sure everybody feels they can be invited. Thank you for being here. We appreciate it.
This podcast is provided by EffectiveCannabis.com, where they learn, study, teach cannabis and cannabinoids to assist patients so they can achieve quality results. We do not sell or produce any products. We study them. I close with one final comment. Pain patients are continuing to experience unjust treatment for pain symptoms and conditions that once were fully recognized and treated. We work every day to give you a voice and a choice. It is taking all of us to make a change. We are strong and becoming stronger the more we work together. You keep smiling and have a beautiful day. Until next time, bye.